I'm joined now by Dr. Richard Besser, former acting CDC director, former chief health and medical editor here at ABC News, and now CEO of the Robert Wood Johnson Foundation. Thanks so much for being with us, Dr. Besser.
Thanks, Ariel. Nice to be here.
The Biden administration has faced some criticism this week for confusion on the timeline of when every American can get the vaccine. Let's just take a step back, though, if you would, with me. How would you say that we're doing as a country on the vaccine distribution right now? And are doses getting out quickly enough, especially given these new variants that are emerging?
Well, I would say we are moving in the right direction. The idea that we have two vaccines that are approved for use this soon into a new pandemic, I think is absolutely miraculous. There have been a lot of bumps along the way in terms of getting vaccines out, but things that give me hope. The numbers are going up every day, and in addition to the numbers of people being vaccinated, we're hearing that there's more intentional outreach to get vaccines into communities that are hardest to reach. So rural communities where people work during the day who may not be able to come to these mass vaccine clinics, a recognition that communities of color that have been hit so hard need to be addressed with vaccination distribution programs.
Certainly an important element. And one bit of potential good news today, with Pfizer submitting new data to the FDA showing their vaccine can be stored in a normal freezer for up to 2 weeks instead of requiring those specialized ultra-low temperature freezers. How much of a difference will this make in getting those doses into the arms of Americans?
Yeah, I mean, we'll have to wait for FDA to review that. But if they go along with the company and they support the data that shows it doesn't need that ultra cold temperatures, I think that's going to be huge. This is a vaccine that required cold temperatures that no other vaccine ever had required. So in terms of being able to get vaccines out to community clinics, to doctors' offices, to pharmacies that don't have ultra cold temperatures, that's going to be terrific. In terms of use globally, in places where there's no way to maintain those ultra cold temperatures, it could have benefit there as well. So I'm very excited about this development.
We've also seen some good news in recent weeks with declining cases, hospitalizations, and deaths. But at the same time, we're seeing some states that are moving to loosen some of the restrictions on businesses, some even lifting the mask mandates. Are you concerned that if we let our guard down, we could potentially see another surge in cases?
I am concerned, especially with the variants that we're seeing being identified here in the U.S. and in other parts of the world. What we saw in Europe was, after a big decline, the emergence of what has been referred to as the UK variant led to a major dramatic increase. And that could happen here. So my inclination is to say let's keep together on this. Let's wear our masks. Let's keep apart. Let's avoid crowded places. Limit our travel. Wait our turn to be vaccinated. And then when the numbers truly decline to very low levels, then you start to reopen. But if you do that before you truly have this under control, this virus could bounce back very easily.
I've got to ask you, so based on our current progress, what's your view of what's realistic when it comes to our future? What can we expect for some degree of normalcy, or should we just be changing altogether our idea of what normal might be?
Well, yeah, I think normal will be different. When I think of the workplace and what that looks like, that may be different for a long time and permanently in some places in terms of remote work. But in terms of there being enough vaccine for people, everyone who wants to be vaccinated to get it and to be able to ease more restrictions, it depends so much on vaccine supply. I expect that within a couple months, from what I hear, the supply will outpace the demand. And so it'll be a matter at that point of trying to get people the information that they need to make a decision so that more people will go ahead and get vaccinated. Hopefully by this summer, we'll be able to enjoy a lot more activity than we were this previous summer. It will be a while before there's vaccines for children. So the school year will look different than this fall will look different than a normal school year. But I'm hoping that this fall, by the end of the year, we will be enjoying life in a way that seems very, very long ago.
We're going to embrace some of that cautious optimism. And finally, President Biden announced today a $4 billion commitment to global efforts to target getting vaccines to poor countries. Now, this does not divert supply away from Americans, as many had mistakenly assumed. But why is this an administration priority, and should it be?
It is so incredibly important when you, for many reasons. One, morally and ethically, we have a responsibility to help ensure that vaccine gets to everyone around the globe who needs it. In terms of our own national interests, though, what we've been seeing with new variants springing up around the globe, that will continue to happen until the entire world's population is vaccinated. So we have a vested interest in that. And by contributing to the fund to purchase vaccines, we will allow lower income countries to have access to the same vaccines that we have access to here. It's a very important step by the government.
Dr. Besser, thanks so much for your insight and spending some time with us on a Friday night. We appreciate it.
Thank you so much. Have a good weekend.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.